Come in.
Hey, is it Jimmy's Pharmacy?
Hi, yeah, welcome to Jimmy's Pharmacy.
Hi. My doctor just diagnosed me with COPD and he prescribed me an inhaler, so I'm here to pick up my inhaler, but I really don't believe it's working.
Okay, sir, I can look you up in the system. Can I get your name?
Dr. Tiwari.
Okay, and can I get the month and date of your birth?
9/19th.
9/19? Okay, sir. So it looks like here the doctor prescribed you a medication called Serevent Diskus.
Okay.
So do you have a few moments to talk about this medication?
Yeah, sure. Yeah, Dr. Jimmy, I don't believe in like inhalers or discus. Does it really help? I have a friend, she didn't like use them and didn't make any difference in her life. So what do you think? Does it really work? I don't have a trust in this medication.
So as a medical professional, I do recommend that you do use this medication because the point of this medication is to prevent worsening of your disease. So if you don't use this medication, what we're concerned about is you ending up in the hospital because your breathing, your wheezing gets worse and worse. And if you do end up in the hospital, it's called an exacerbation. And if that does occur, it worsens your disease progression significantly.
Okay, does it have to do anything with the smoking? Or I've been smoking for 35 years, so I don't know.
Yeah, for COPD, one of the most common factors that plays a role is smoking. So what I do recommend is that you try to quit smoking, and we can help you develop a step plan to help you quit smoking.
Okay, great. I would love to get back to life.
So the doctor prescribed you Serevent Diskus. It's a medication used for either asthma or COPD, and your doctor wants you to use it for COPD.
Okay.
The doctor wants you to take this medication twice a day. How you want to take it is you want to inhale one puff, that's 50 microgram,
Great.
by inhaled route. So take it in the morning, inhale it in the morning, and later, 12 hours later, inhale it again.
Okay, so twice a day.
Twice a day, correct. And I'll teach you how to use this Diskus since this is your first time after I go over how to store the medication, what is some of the common side effects, what severe side effects to watch out for, and other information you may need.
Okay, great. I've never seen something like this in my life, so that helps.
So the most common side effects for using this medication would be like headaches, and you might experience some muscle pain as well. What to really watch out for, the serious side effects, is called QT prolongation. So what that is it causes irregular heartbeats. It also causes palpitations. So you feel something weird going on with your heart, let your doctor know.
Okay, so if I feel something going with my heart rhythm, I just call the doctor.
Correct. So for the safety and efficacy, this drug is relatively safe to use besides those serious side effects that I mentioned before. For the efficacy of this drug is actually used only for symptom prevention and control. So the actual medication is not actually used to slow down your progression of COPD. The only way for you to slow down the progression of COPD is actually to stop smoking. And we'll go over some smoking cessation counseling points after I talk more about this medication.
Okay. Yeah, sounds good.
Some other things you should know is that this medication is actually not used for an acute attack. So as we mentioned before, use it twice a day as scheduled. So make sure you use it every day in the morning. 12 hours later, use it in the afternoon.
Okay. So it's not for like rapid response to attack or something.
Yeah, it's not for rapid response. It's more for long-term response.
Okay. Thank you.
And make sure when you're taking this medication, you don't use any other beta agonist drugs. So are you taking any other medications?
No, like salmeterol and stuff like that. Yeah.
Yes.
Okay.
Okay, that's good. And also, do not exceed the recommended dose for this medication. So when I teach you how to use this medication, even if it doesn't feel like you inhaled it, don't repeat.
Okay. So just one time and that's it.
Yeah, one time.
All right.
Dr. Tawari, so now I'm going to go over how you want to use this medication. So this is a sample medication, so I'll use it as if I was the patient using the medication.
Yeah, it looks like a hockey puck.
Yeah, it does. So when you open it like this, and later you want to load the medication, so you pull this back.
Okay.
And once you pull this back, what you want to do now is you want to exhale completely, but not into the discus. So just exhale completely. Then after you exhale completely, you inhale completely, holding over the discus. So when you inhale as much as you can. Later, once you feel all the medications in your lungs, hold it for 10 seconds, or for as long as you comfortably feel.
Okay, so just hold it for 10 seconds
Correct.
to get it. Okay.
And then afterwards, once you hold it for 10 seconds, exhale really slowly.
Okay.
And that's pretty much how you use the medication.
So this way I get the most of the dose inside.
Correct.
Alright. Sounds to be easy.
Or what I recommend you do to make sure you take this medication every day is set an alarm in the morning and in the afternoon. That way it reminds you to use the medication. Because it's really important for you to use this medication for yourself.
Yeah, adherence is kind of hard for me to get it to work. Okay, so just like do something in life to make sure you do it like in morning and afternoon.
Perfect.
Okay.
Mm-hmm.
And then I'll follow up with you guys.
Yeah, follow up with your primary care provider in 2 to 6 weeks.
Okay.
See how you're doing on this medication.
Okay. Alright. Sounds good.
Sounds good, sir.
Yeah.
Okay, Dr. Tawar, so this is how you're going to store the medication. So when you open it, store it somewhere cool, dry, preferably in the closet or something. Keep it away from sunlight. And once you open it and start using it, discard it after 6 weeks. Or after the full discus is used, whatever comes first. So if you use it within 5 weeks, discard it. Or if 6 weeks occur and there's still some, you still have to discard it.
Okay.
Mm-hmm.
So the max I can keep it is 6 weeks.
Correct.
Alright. Sounds good.
Dr. Tawar, so I went over everything that you need to know about this medication. Do you have any other questions for me?
No, not at this point.
Okay, that's perfect. So I know when you came in, you wanted to maybe quit smoking. Is that something you want to discuss now or at another time?
I'm gonna think about it and let you know when I'm ready, like mentally. Yeah.
Okay, sounds good, sir.
And then I'll follow up with you.
Yes, follow up with me in 2 to 6 weeks when you can.
Alright, thank you so much.
Have a good day, Dr. Tawar.
You too. Thank you. Does it really work? I mean,
Okay, I could look you up, sir. So what's your name?
Jason MacArthur.
Okay, Jason McGrath. Can I get a date of birth?
Well, actually, my name is Rakesh Tiwari.
Can I get your name?
Rakesh Tiwari.
Okay, and can I get a date of birth?
9/9/99.
Okay, sir. So
I had to calculate at 55 years old or no?